Welcome back to Foxhole's Black Report. Well, May was Allergy and Asthma Awareness Month, but the impact of these conditions doesn't just stop there. In fact, they remain relevant even in the summer months.
Yeah, especially in the summer months. Today, we have a very special guest joining us, Dr. Renee Matthews, an expert in asthma and allergies. Dr. Renee, thank you so much for being with us today.
Thank you for having me.
Absolutely.
And so let's just dive right on in. So first things first, can you explain the difference between allergies and just being sick? Because a lot of us get that confused.
Right. So being sick is usually a very short window, low fever, et cetera, et cetera. You know, yes, you have the sneezing and all that, but it's short window. You know, a couple days and you feel better. Allergies, you realize that you feel like that every year around the same time, and it lasts for weeks and weeks and weeks of runny nose, no fever, but runny nose, itchy throat, itchy, you know, just itching, might be your skin itching too, you know, just all of that, watery eyes, itchy eyes. All those things.
So pay attention to duration.
Exactly.
And pay attention to fever. Those are the two distinctions. Okay.
There we go. Okay, so you talked about some of the symptoms, some of the suffering that the soulmates have during this season, in particular summer. Today is like a low air quality day here in Detroit,
It's bad for
Michigan.
asthmatics to be out.
Yeah, so talk about some of the relief. I know some of
Yes.
us resort to the over-the-counter stuff. Some of us have it so bad that we have to actually go see a doctor. Talk a little bit about the relief.
So over-the-counter antihistamines are wonderful, but if you don't know what you're allergic to, I think you're just like throwing a dart into the air. So you want to see an allergist and find out exactly what are you allergic to. Your allergist will probably suggest allergy shots. I highly recommend them. I did them myself when I was a kid, and now I ran this morning outside. I saw the flying things, no sneezing.
On the low quality air day.
Exactly, and I was fine. And I stay outside actually in these months. You want to take a shower or bath as soon as you come in your house, because you need to wash all of those allergens off of your body. Take the clothes off, put them in a hamper, because if you bring them in the house, then you still all in your house.
Dealing with it,
because you've spread it all around. Try saline nasal sprays, humidifiers, excellent to sleep with, and like I said, the over-the-counter meds, they are great, but if you know what you're dealing with, they're even better.
And when we get a little extreme, I know I moved from one state to the next, and I just went ballistic. My body went ballistic, so I actually went and got a test. It was regular, and they put something on me, and I bumped all up, and so I found out that I had allergies that I never knew, but when I moved away, they went away.
And that happens sometimes. Sometimes it's the other way around.
It's so confusing.
Yeah, sometimes it's the other way around. You go places and you start, all of a sudden you never were sick and now you're sick. So that can happen too.
So a change in atmosphere.
A change in atmosphere can definitely, and you know, even for asthmatics, I know a long time ago they recommended that they lived in Colorado, and and even though with the, you know, the altitude, I thought that was a bit odd, but I have a relative, that's what they did, and it was better for his asthma.
Yeah, so much information out here. It's kind of hard to decipher through it.
I mean, we were talking, you know, before the show about this sort of chronic laryngitis that I've had, right? And so I just thought, well, where did this come from? You know, before I moved to Detroit, I'd never experienced anything like this. And you were saying, well, it could be an allergy. And so, you know, I'll have to look into that. But Dr. Matthews, I got to ask you to share how you became an expert in asthma and allergies, of all things. I mean, you know, you're just over here dropping gem after gem. You know, where did all this expertise come from? What drew you to it?
With severe asthma and severe allergies. As a matter of fact, I'm wearing teal for food allergy awareness. I have severe food allergies. And I was, like I said, allergic to everything outside. My mom, thank you Jesus, was a respiratory therapist in the Detroit area. Most people do know her actually, Joyce Matthews. And she knew what to do. So she got with my allergist, and they were like, this is what we're dealing with. And she said, you know what, she needs allergy shots. She said, you can even give them to her. I had allergy shots for like good 3 years, and that helped me tremendously. I think since I was 5, I wanted to be a doctor, but I knew I never wanted to be an allergist because it was boring to me, because I had taken every drug known to man. You know, I have had every test done, so it was boring to me. But when I became an adult and everyone was like, Renee, you need to write a book, you need to write a book. And so I said, okay, they were like, you know how to do this allergy and asthma thing. write a book about that.
Study it and write a book.
Yeah.
And
so,
speaking of the books, you can tell it's successful because we have the hardcover and the soft cover. You know, you start with the hard, and then when you transition to the soft, that means you have a successful sale here. Talk a little bit about, we know, of course, what has inspired you, but talk a little bit why you're focusing in on, the younger folks in particular.
So, unfortunately, bullying is a huge thing, as we all know, but did you know that they are actually bullying kids with food allergies and throwing their food allergens at them?
That's awful.
Which is deadly. Like for me, I'm allergic to raw eggs. If you threw an egg at me and I couldn't get to my medicine quickly, I could stop breathing. Wow. So that was why I said if we could get the little kids to understand that food allergies is just, that's what Johnny has, just like you might have a stammer or something. If we could get them, then maybe we wouldn't have big kids that were bullies. So that's why I wrote it for the 4 to 8 year old, kind of before you get to kindergarten. The story is about me in kindergarten. So
has it been hard to sort of kind of get them to understand, asthma and the responsibility that comes with that? I know as a 4 and a 5 year old, you're in school, you want to run around just like your other friends, but you got this thing that you got to, maintain and not lose in order to stay healthy. Yeah. So
most kids. And that was what I recently was advocating about allergies and asthma. We don't have enough nurses in schools. So if your school doesn't have a nurse and your kid has to take meds, they can't go to the school because.
Oh, wow.
Yeah, isn't that awful? So they don't usually carry it, but they have to go to the nurse. And most kids, like for me, I just understood that I'm going to start wheezing if I run for too much or something. So I think most of them pretty much kind of understand. Now it's trying to explain it to other kids. But if it's you probably understand.
So before we let you go, we have to ask you, why is allergy season particularly miserable this year? And what role does our environment play in our healing or our misery?
So, remember that ozone layer thing?
Yeah, that big argument.
Right.
Okay.
So the global warming, unfortunately, is why we are so miserable. The pollen season is longer because the seasons have been longer. Pollen started earlier because of that as well. There's a really amazing thing on the allergyandasthmanetwork.org website. You can go hit weather index and you can put in your zip code and you'll find out all this amazing information about the pollen index and allergy alert and asthma alert in your area because it's important now.
And the flu index.
And the flu index, yes.
Cool.
But it's that's why. It's because of that global warming. So I guess if we continue to do things the way we're going to do them, we're going to have more and more people with allergies coming forward. But if we actually recycle and do the things that we're supposed to do,
we'll be in better shape.
We'll be in better shape.
Real quick, how can we link up with you, follow you across social media?
I am Ask Dr. Renee on all social media, AskDrRenee. And my website is AskDrRenee.info because I'm a resource for information.
Yes, you are.
We're going to keep asking.
I know, and you are absolutely delightful.
Thank you.
Yeah, thank you so much. And these books are beautiful. I have my copies, and they're gorgeous. Thanks for joining us today.
Thank you. Thank you for having me.
Dr. Renee.
That's right.
Matthews, Ask Dr. Renee.